Good evening, everyone, and welcome to ATP Live Monday. I hope you can see me and you can hear me, whichever platform you're watching on. Welcome to ATP Live Monday. In quite a while, we have ATP Live Monday due to the public holidays. Um, yeah, but you're welcome. It's good to be back. All right. So, ATP Life Monday is a program brought to you by Ask the Pediatricians Foundation, where you can ask any questions you have about your children's health issues in 1 hour. Okay, so we have 1 hour for you to ask any questions you have about any issues that relate to the health of your children, and I'll also try and answer them. And today is the World Sickle Cell Day. Okay, so happy World Sickle Cell Day to all our sickle cell warriors out there. I will do a little bit of talk about that, and because Nigeria, we have the highest number of people with the sickle cell traits in the world. We have the highest number. So it's our own cystic fibrosis to the Caucasian. So it's a condition that we should all know about. It's very common. And then I will try and talk about some myths around sickle cell anemia, especially how it's passed on from parents to the children. There are lots of myths around it. We'll try and address that. But as I'm doing that as well, I'll be taking your questions and your answers on any health issues that you have. So welcome. It's good to see you all. Before we start, can you please help me to share the video to whichever platform you're watching, or to your friends, your family? So I'm also going to try and do that first as well. And after that, we can start fully. So welcome everyone. I can see you. I just want to make sure that people on our groups, they can see me as well. So I'm just going to pin the videos and then we can start fully. Welcome everyone. I hope you've had a beautiful Monday. And I also want to welcome those of you who are watching the broadcasts after it's been live has ended, because some people come to watch the live broadcast after it has ended and then they start asking questions as if we're still live. So if you are watching this video after 7 p.m., we are no longer live. So if you're watching after 7 p.m., you are not watching the live broadcast. So for you, please, you have to go to our Facebook group to post your questions there, because that is where you are going to see it. So you don't be confused, because some of you are like, oh, why is she not answering my questions? And I'm like, oh, you're not live. So I can only answer questions that were posted when I was live, or like now as I'm live right now. So if you're watching after the live session, please don't get upset. What you need to do, but you can say ask your questions, but you have to post your own questions to our Ask the Pediatrician Facebook group, and then we will answer it. So the questions that we answer live are the questions that are asked during the live section between 6 p.m. and 7 p.m. It's always written there, the time for the program, but people come in, they don't look at the flyer of the program, and they get upset. So you have to watch within 6 to 7 p.m. to get live answers. So this information is for those who are watching the repeats, who are watching the recorded broadcast. So you can only get answers to your questions live if you are watching between the hours of 6 and 7 p.m. So if you're watching after 7 p.m., please don't drop your questions under the video, go straight, because I won't be live then and I won't say it and I won't be able to answer it. But I can still answer your questions. And the only way I can do that is if you go to our Ask the Pediatricians Facebook group and post your questions there, and then I will be able to answer that question at that time. Okay, so no worries whatsoever. We answer questions every Monday to Saturday, 24 hours daily. We answer thousands of questions every week. So you can always post your questions anytime, and our pediatricians, our moderators will address them. But for the live one, I can only answer them between 6 and 7 p.m. So if you want to get your question live, like sharp as you're dropping it, you're getting Dr. Bimi answering it straight away, you have to be on the live program. That's just what it means. And it's every Monday, unless if it's a public holiday. If it's not a public holiday, every Monday 6 to 7 we are here. So just make it a date in your diary and always join us, and then I will always be here to answer your questions. So while I'm doing all that, I'm just trying to share the videos, I'm pinning it and doing all the usual admin stuff. So I'm almost done now, and I think we can now start to take questions. So please start dropping your questions again. Then remember, we have just 1 hour. So what that means is that you have to post your question in 1 hour now. If you don't post your question in 1 hour, it will be gone. And some of us always like to ask our questions towards the end when we're all rushing. So please don't leave your questions to the end. Please ask now so that we can put them quickly. And I can see some questions as I coming through. Just give me 1 more minute. I'm just posting and pinning it to all our other groups. Okay, I think I'm done now. So we'll start taking the question. Instagram people, I can see your questions. I hope you can hear me. Please, if you're on Instagram, you can hear me, let me know. Drop your questions. Some of you always request for me to add you to my video on Instagram. I'm sorry I won't be able to do that, but I will answer your question. You can drop your question as comments, or you can just put it in the question box. That's for those on Instagram. If you're watching on Ask the Pediatrician Facebook group or ATP YouTube channel or ATP Instagram page, you can just drop your questions right there on the video. But if you're watching on ATP Family Facebook group, ATP Still a Mom Facebook group, or FTM Facebook group, you have to click on the video. Or if you're watching on my page, you have to click on the video and then go and drop your question directly under the video on the page. That's the only way I'll be able to see your question. All right, so great. I think we're ready to start. I can see some questions. Good evening, everyone. So like I said, today is the World Sickle Cell Day. And I have my flyers there, but hopefully I will share it later on. So welcome back, everyone. All right. So I will be talking more about sickle cell anemia. We have to talk about it, but I'll also be answering some questions in between. So Francisca, good evening. You're the first person to ask the question. How can one break tongue thrusting habit for a 5-year-old? Tongue thrusting habit for a 5-year-old. The first thing I want to know is why is the child tongue thrusting? Because there are different scenario that can be going on here. Is a child bringing out the tongue? Is that what you mean by tongue thrusting? And it's like an habit for the child. So like maybe when the child is kind of kind of forget themselves or distracted, and they bring out their tongue and suck on it. That is an habit, which is something some children do. That is different as against a child who is tongue thrusting like a sudden episode, like that they are unconscious of fun. They don't know when it happened, which can be a form of a seizure. So you really need to. But if it's what I think you're asking, which is just like an habit, just the same scenario like a child with sucking their thumb, fingers, and all that. So most of those habits are common in childhood, and most of the time the children outgrow them. Most of our strategies as parents, which is to punish the children or to force them to stop and embarrass them, they actually don't work. They're actually more um I can actually kind of reinforce the habits more. So what we tend to encourage is number one, distraction. So that's one thing. For children, for example, you can give the child something to bite on, or there are a lot of chew toys that children can bite on, and because when they are doing that, it's very unlikely for them to bring out their tongue. Or sometimes you can give them like rewards when they do the right things and all that. So, but the good news is that most of the children will outgrow this behavior by the time they're about 6 years old. So usually we just tell parents just hang in there. But if there are other issues with the child, developmental issues and all that, then it may be wise to see a pediatrician physically to get more support. I hope that is helpful for you, Francisca. If you have more information about what I just said, and I hope you're listening, because some people kind of get distracted and go and I know we're all multitasking, it's fine, but you can always watch the video again. If you are there, you still want to give me more information, you're free to do that, and I will try and answer that. Right? Thank you. Good evening, Facebook user. Good evening, Facebook user. If you're on our Facebook group and you want me to see your name, you have to give StreamYard the permission to show your name. Otherwise, I will just be seeing you as a Facebook user. But if you are not bothered about that, it's okay. But the clause to that is that if you are asking questions, please put everything together in one box. And if you want to give me additional information, don't just start in the middle. If you're asking from our Facebook group, you have to start all over again, because I won't know which of the Facebook user is giving me additional information. So I won't know which one to marry together. So you always have to start from the beginning every time. Otherwise, I'll be confused and I'll be lost. So just don't let me be confused. Okay, now we lost. Okay, I hope I got your name. If I didn't, please, my apologies. Does sickle cell anemia have an inheritance order? Yes, it does. So sickle cell anemia is a genetic condition. So when we say something is a genetic condition or it's something that can be inherited, it means it is passed from parents to the children. All right. So there's what we call the sickle cell trait. So we all have, okay, let me go back. Let's go back to biology. Let's go back to our sciences. So we have what we call chromosomes. We have what we call genes. Okay. Now, chromosomes are like the long proteins that store the genes. Okay. Now, the genes is what code information. So I am black because my mom and my dad, they are black. So there's a code for my color, my skin color to be black from my mom and from my dad. I got one each from my mom, one from my dad that is passed on to me. Okay, and I'm also passing one down to my children. They will get another one from their father. So every trait you have, you inherit it. Okay, whether you're going to be tall, whether you're going to be short, whether you're going to be black, whether you're going to be fair, whether you're going to be so many things, it's passed on from your parents to you through what we call genes. So there are what we call 2 sets of chromosome per each chromosome. So we have 23 chromosomes, we have 23 pairs. So pairs mean 2 of each of them, and one is from the father, one is from the mother. And then that is how, so you inherit. So the egg and the sperm, they have only 23, not pairs, just 23 chromosomes. So when the egg and the sperm now come together, the child or whatever is from the fetus, we have 23 pairs of chromosomes. Okay, so it's important for you to have that. And on each of those chromosomes are thousands of genes for everything, for your eye color, for your hair color, for your height, for your weight, so many genes. Okay, and there's one for your hemoglobin as well. So the hemoglobin is what carries oxygen in the red blood cells. Okay, so the kind of hemoglobin genotype you have is also coded. Okay, so some people have what we call the genotype, hemoglobin genotype AA, which is what we would count as a normal one. But for some reason, for some alteration, some people have an abnormal form of the hemoglobin due to some alteration that has happened in the genetic level, and they have what we call the X hemoglobin. All right. So the challenge with that is that if you have an A hemoglobin gene from your father, you have the A1 from your mother, you're going to be AA, and then you will have hemoglobin AA type in your red blood cells, and that is fine. Sometimes some people have A from their father, maybe X from the mother, so they have AS, all right? And there's no problem with AS people as well, but they carry the X gene. Now, what happens is that those who are AS, though they themselves are fine, we call them, they have what we call the sickle cell traits. In other words, though they are fine, but they can pass on that S gene to their own offspring. Now, if somebody who has the sickle cell traits marry somebody else who also have the sickle cell trait, for every pregnancy, because people always get it wrong. They think, oh, that means that there's only one. If they have 4 children, one child will be sickle cell. No, it is for each pregnancy. For each pregnancy, there's a probability that 25% of the time, the 2X, the father has AS gene, the mother has AS gene. Sometimes it is the A and the A, luckily, that will come together and they're going to have a child who is AA. Sometimes it is random. This is a random chance thing. It is the A from the father and the X from the mother that will come together and they are going to have an AS child. But sometimes, 25% of the time, they can have the 2X from the father and the X from the mother coming together and they're going to have the XX child. This is somebody, so those who have SS, 2 abnormal hemoglobin X, we say they have what we call the sickle cell anemia. And why is this a problem? Because the XS gene, the hemoglobin X, it tends to make the red blood cells to sickle under certain circumstances. So the red blood cell is supposed to be round, so that it can easily move around in the red blood, in the blood vessels and all that. It can carry the oxygen, can do so many things. But when oxygen is low, under certain circumstances, dehydration and all that, the the hemoglobin X tends to kind of change shape, and it will change the red blood cells into what we call a sickle shape, the sickle for harvesting. It changes into that sickle shape. And what that happens is that then they begin to gum together. And when they gum together, they can't carry the red blood cells will be destroyed. They can't carry the oxygen. Then they also block the red blood, especially the vessels where they are very tiny. They kind of block it. So blood cannot flow into those areas. And that's when people begin to have pain. They begin to have what we call the crisis. So they can have pains. They have all that. So it's because of what is going on with this abnormal hemoglobin, leading to these abnormal sickle red cells and causing all these chains of problem. So everything goes back to the inheritance. So sickle cell anemia is inherited, and it's inherited when 2 people who have the S traits marry together and bring up a child. And for each pregnancy, there's a chance that 25% chance is going to be an SS. There's a 50% chance it's going to be AS, and there's a 25% chance it's going to be AA. So what happened is that it's possible for somebody to have all their children, luckily will all become AA, or all the children will be AS, or a mix of the two, or it's not supposed for all the children to be SS. So, and I've seen family with that. I've managed families where all the children are SS. So, and is in and out of the hospital for such families, it is very difficult when you have children. And another thing that with SS, some children have SS and they are absolutely fine. So there's also what we call phenotype. There's what we call the genotype, and there's also what we call phenotype. So your genotype is what you have in your genes, what you inherit, but your phenotype is how it manifests. So I've met women who don't even know they have SS until they were pregnant. And somebody said, okay, because you're pregnant, we have to do your genotype. It's part of our routine test. And that's the first time in their life that they know that they have the SS genotype. They never know. They've been perfectly healthy all their lives. So that is one phenotype. And I also have friends and I've known people who are in and out of the hospital every single day of their lives. And some of them have died because they are so sick. Some of them have stroke, and some people have, they are on blood transfusion, like what we call chronic blood transfusion. They are very sick. And of course, you have people in between. So that is the phenotype. So some people will be sickle cell, LD, otherwise fine, doing well. I think there's the oldest person right now with sickle cell was 90. I don't know whether he's still alive right now. So you have somebody who is 90 years old who have sickle cell anemia. And then you also have people, I have classmates and people who died with sickle cell anemia, as young adults or young adolescents. So this is the phenotype now. So going back to because today sickle cell day, so I've taken time to really explain that first, so we all know. So when I was in my undergraduate level, I did a survey among University of Lagos and students, I think Faculty of Engineering, asking them whether they are going to change their mind when they know the genotype of the spouse, of the fiancé or the girlfriend based on this information. And it's a little bit difficult for many people, especially if they're already in a committed relationship. So the best thing is to know your genotype before you get into any committed relationship, so that you will know if you already if you are AA, then you can marry anyone. You can even marry somebody who is SS. It doesn't matter, because all your children, you're only going to be giving A, and you're going to be helping us diluting the by the way, 25% of Nigerian population carry the S gene. So it's quite common in our environment. And 2% of our population, 2 to 3%, have the SS gene. Okay. So it's one of our commonest genetic condition in Nigeria. So so if you're AA, you don't have any problem. If you're SS, you can only marry an AA, otherwise you're going to get into more trouble. But if you are AS, which is 25% of us, you have to make sure that when you want to get into a relationship, you need to know the genotype of your spouse today. All right, and make your decision. And I know a lot of people are very emotional about this, and maybe we'll do this. Of course, there are ways around it. Okay, so we have what we call prenatal diagnosis, prenatal testing. In other words, for each pregnancy, we can actually test the pregnancy for you to know whether it's going to be AA or AS or SS. We can do it. And then the question is, you want to terminate the baby? If this baby is done, if baby is SS, that's another ethical decision for people. Some people don't believe in abortion and all that. So you have to make up your mind. Of course, there are lots of advances in science, but I think for somebody like me who have sat at the bedside of people, of children who have sickle cell anemia, who are going through painful crises, and I've seen them cussed out their parents. I mean, cuss them out completely, like, why did you bring me to this world? Why did you make me suffer this pain? I'm telling you, it can be very heartbreaking. And so it's something you really want to decide well about. So, and of course, once a child already has a diagnosis, there are still support we can give to the child to make sure that they live as much healthy life. We have to make sure they are always well hydrated. Things that tend to trigger off crisis, we have to deal with it. In Nigeria, malaria is our own number one. So sickle cell anemia people are going to be prioritized for the malaria vaccine. We make sure we give them paludrin every single day of their life, so that they can be protected against malaria. They have to drink a lot of water so that they can be well hydrated. They avoid stress. Anything that can stress them, anything that can trigger health crisis, you need to avoid it. So, and then of course, some we need to check their blood levels. And there are some things that if the PCB is too high, sometimes we have to monitor it, because we have to monitor them for what we call stroke. We don't want them, because that's another thing. Complications of sickle cell anemia. Complications of sickle cell anemia are so many, they can affect virtually all the body organs, all the body system. So it's not only just a crisis, but each of the organs of the body can be affected by sickle cell anemia, because the blood flows everywhere. So anywhere there's blood flow, you can imagine where there's blockage of blood or blood is not flowing there, you can imagine what can happen in those places. So these are all the complications. And just children have to be registered with the sickle cell clinics. There are sickle cell clinics in virtually all the states of Nigeria, in virtually all our teaching hospitals, virtually all the general hospitals run either a sickle cell clinic or sickle cell club. You have to be going to one of them so that your child can be managed and can be supported. So I hope Luster, you've gotten the answer now. So it's supposed for somebody who have sickle cell traits to have all their 4 children means SS, and it's possible for them not to have none. Some people are lucky, but you never know who's going to be lucky. So it's a little bit tricky. So the best thing is to just make an informed decision. Our role as clinicians is to advise and to inform you. We also have genetic counselors who are well trained. If you want genetic counseling, the Sickle Cell Foundation, opposite Lagos University Hospital in Lagos, they offer genetic counseling. Or if you go to their website, I'm sure you will know where you can go for genetic counseling in the country, where depending on which states you are. So I hope that is helpful. All right, I think I've done enough talking about sickle cell anemia, which is for today, and I can start continuing to take all the other questions now. But if you have any questions still about sickle cell anemia, feel free to put it up and then we'll answer them. All right, so somebody's saying, good evening. I hope I'm on the right Instagram page. Just a minute. All right, just checking. I'm not on my own Instagram page. Okay, yeah, I'm on the right one. Okay. All right, so somebody said my 1-month-old baby has catarrh, and I went to the hospital. I was asked to give him vitamin C and to keep him warm, but the catarrh is not going. So you don't need to do anything. Breastfeed your baby. Most catarrh in that age group is due to virus. Most of them are going to go by themselves, so they don't need any medication. The most important thing is for you to keep the child away from people who have got cough and catarrh, and make sure you keep your baby warm. Breastfeed the baby exclusively. No formula, no water, nothing. Just breast milk only. The catarrh itself is going to go. You don't need to do anything. All right. Next person. Can sickle cell fetus be a cause for miscarriage? Well, not necessarily, but it's a possibility. But most of the time, sickle cell babies are born normal. They are not miscarried. They are born normally like any other person. So, but it's not a frequent cause of miscarriage. That's not the issue now. Good evening. Thanks for what you do. Please, how does one treat bad breath? Okay, in a child. So when you're asking questions, always say the age of the child. It's very important for us to know the age of the child, because that way we can kind of let you know the specific likely causes of that condition in that age group. So for I don't know the age group of this child, but I want to assume for younger children, you want to look at things like the dentition. You want to make sure there is no dental caries and things like that. So that is number one thing that you want to do. Make sure that they brush their teeth twice a day, morning and afternoon. Not afternoon, night, first thing after breakfast and last thing before bed and all that. But there are other things that could also cause bad breath. So if a child has like tonsillitis, any condition affecting the teeth, the throat, the hair, all those areas, it can also make the children to have bad breath. So bad breath is even the nose. It's not always about the teeth. Every other organ within that area can also cause bad breath for the children. So you just want to make sure that all that is sorted. So if you're not sure which one, the best option is to take the child to see a doctor, and then they can examine the child for you, and then they can advise on what they think is causing the bad breath, and we just need to treat it and the child will be fine. So that is about that. Somebody is saying, good evening, I'm just worried about my 6-month-old baby, about throwing up habits from the nose and the mouth. Okay, so a 6-month-old should have been on solids now, so you should be starting solids. So reflux is when babies bring out some milk, usually from the nose and the mouth. But usually most of the time when the children start solids, usually from 6 months, it should be less. So if your child is still throwing up a lot, even after you've started solids, then there's something wrong. But make sure your solid again is solid, because some of us, when we're starting complementary feeding, we give them pap through bottles. Complementary feeding should never be given through feeding bottles. It should not be watery. Your pap should not be watery. It has to be thick. It is thick porridge. Everything is thick. It's mashed or pureed. It's never watery. So make sure you are giving your child proper complementary foods. Make sure you are breastfeeding as well. When you finish feeding your child, make sure you keep them upright. Don't just finish feeding a child now and you just go and throw them on the bed to sleep immediately. They are going to bring back the food. So they should eat and the food should settle a bit more. Keep them upright for 15 to 30 minutes before you put the child down. But also make sure the child is actually not vomiting, because there's a difference between vomiting and reflux. So vomiting is the child is actively bringing out everything. So you finish with your child is retching and forcefully bringing back the milk and everything. That is vomiting, and that is not reflux, and that has to be seen by a pediatrician. But if it's just reflux, a little bit of the milk coming back and all that, then that's most children will outgrow it as soon as they start solid. And by the time they stop milk and they're fully on family diet, usually by the age of 2, then they shouldn't be having reflux at all. So if it is really bad, you have to go back and see your pediatrician. Okay, I think I will take one question from Instagram and then we'll come back to Facebook. But Instagram people will get tired of me now. Okay, I can see only one question on Instagram. Tommy AK1. I'm worried that my 10-year-old girl is no longer growing. What do you mean she's no longer growing? She weighed 35 kg and 135 cm last month. I checked. So when children start getting to the age of like 5 years, 6 years old, you don't need to check their weight every month. It's no longer every month affair. Once a year is okay. So you don't have to be monitoring them every single month to see. That one is for the first 1 year or 2 of life. Usually by the time they're about 2, we even do it maybe every 6 months or so. By the time they're about 8, 10, 9, just do it once a year. We don't have to check their weight every month. So they're not going to be growing because the rate of growth is going to slow. So the fastest rate of growth is in the first 1 year of life. They go from 3 kilos to 10 kilos in 1 year. But that is 7 kilos in 1 year averagely. But between 1 year and 2 years, it's going to be just 2 kilos. So they're not going to be growing at the same rate they were growing in the first year of life. So between 2 years and 3 years, again, just another 2 kilos. So that curve is going to slow down and it's going to remain slow a little bit. So they'll only be adding a little at a time until they reach puberty, which usually again from 10, some children start a little bit early, maybe 8 to 9, and then you begin to have another spot of growth again. Boom, that's going to take them to the adult's height or weight, and then it will stop. So we have period of rapid growth, we have period of slow growth. So I'm not worried about your 10-year-old weighing 35 kilos. That's okay. You don't have to be expecting them to be growing rapidly the way they were growing before. And so that's why you don't need to be checking their weight every month or height every month. Just let them be eating well and then they'll be fine. All right, that's the only question I have on Instagram. I'm going to go back to Facebook. Um, Instagram people, well, you can still drop your question and we'll answer them later. Somebody say, keep up the good work. Thank you. Somebody say, good evening. My 5 months old baby pulls a lot. I guess you mean pull like passing stool. Uh, Normal breastfeeding baby pool, that's normal. So as long as the stool, the pool, whatever you want to call it, as long as it's normal, the number of time it is passed is irrelevant. A lot of mothers worried about that. No, we are not worried about that. We're worried more about the texture of the stool. Okay, if it is watery and more than 3 times, then that qualifies as diarrhea. If it is hard or pellets like and it's not happening every day or then that qualifies as constipation. Those are the only two things we're worried about as stool. If your baby like and pass through 20 times a day, as long as they are normal stool, it's nothing to worry about. So bowel movement varies widely from one child to another. Okay, and it is nothing to worry about. So 3 to 4 times a day is normal. There's nothing there. Some babies can pass it up to 12 times a day and it is still normal. In fact, some babies pass through every time they feed, they will pass through and it's also normal. So the stool the baby is passing when you feed them, it is not this food they are eating right now they are passing, which is in most mothers' wrong assumption that, oh, the baby is passing out the food as they are eating it and they won't gain weight. That is a wrong assumption. The food that baby is passing out is the one that has been eaten maybe over 6, 8, 12 hours ago, that has gone through all the process of digestion and absorption, which sometimes can take up to 16 hours. So it is not the one the baby is eating right there and then that the baby is passing out. But when baby eats, there's what we call peristalsis, the stimulation of the waves. The waves, and they start from the mouth and carry through the esophagus, because the digestive tract is just one long tube that opens from the mouth and opens at the anus. It's just one long tube that is so convoluted. So when you start eating and food starts to move, there's a lot of waves, and that wave will go from the mouth down to the anus. So anything that is stored in the anus, the baby will feel like passing it out. It is because of what has been stored there before, not the one that is still coming. The one that is sick, the baby is just eating, still going to take another 12, 16 hours to get down to the anus because it's a very, very long tube. So there's nothing to worry about. Okay. Keep up the good work. I think I've answered that. All right, that's that. Good evening. My 8 months old, I used to eat homemade food. Just stopped eating since yesterday, and the only thing he likes taking his breast milk. So baby's appetite can vary from time to time. So sometimes it may be the first time they are about to get sick when they start losing appetite. Sometimes they are bored of the same food, because some of us, the way we do our complementary feeding, we do the same thing. Maybe it's the same pap or the same cereal from the shop that you give them 24/7. I mean, if it is you, you'll be tired. You'll be tired of eating rice day and night. Some of us are like that. So the same way you should look at the children. So make sure you are not just giving the same food all the time. Make sure you do variety. You can cook your rice maybe 7 different ways. You can do white rice, you can do fried rice, you can do jollof rice. So you have to experiment with variety. The same thing with the food. So don't just keep giving the same pap or the same cereal that you just quickly mix and give them. Make sure you do variety. Make sure the child is not tired of the same thing you're giving. All right, and just also watch that the child is not sick, no fever. Just monitor them and just keep off giving the food and see how things improve. Good evening, Olucheko. Love you too. Thank you. Is it true that sickle cell gets better with time, or it's just a myth? So I don't know whether you listen to my presentation, or as I will call it. I mentioned phenotype. So phenotype is different. Phenotype is how sickle cell anemia presents. So everybody can have SS gene. Some people will be perfectly healthy, they are not sick. they are otherwise well. And I know people who have sickle cell anemia who are perfectly healthy, who don't have any illness, but we also know people that are in and out of hospital. So it varies from one person to another. Then I find that some people in some environment, they do better. So I have a friend who, when she was in Nigeria, was having crisis almost every time, and but when she traveled outside Nigeria and she went to um, uh, America, the weather there is better for her, so she wasn't having malaria and all that, and she's never had crisis since then. So some environments are better off for some people and all that, but also I have people even in the UK who have sickle cell anemia who are having serious crisis as well. So it varies from one person to another person. All right. So there's no way we can't say it gets better with time. It just individual thing, but we are getting more advanced with our technology, and we're beginning to high what we call gene therapy now. We are looking forward to us repairing the gene itself. In other words, we're looking towards going into the gene and correcting that sickle cell gene, and so that it can produce the A hemoglobin instead of the X hemoglobin, and that will be the cure of sickle cell anemia. And research is really advanced now. We're hoping very soon we get there. Right now, we already have what we call bone marrow transplantation. Bone marrow transplantation, we sometimes use the cord, what we call the stem cells from the baby siblings or anyone who is AA, and we transfuse it into the other child. So we kind of kill off the child's own bone marrow and put in the stem cells from somebody who is AA, who is relative, who is related. And some people come back and they are AA. So they are permanently cured of SS. They begin to produce the A genotype. But the challenge with that is that you are knocking off the child's immune system completely. That child cannot even catch any cold. That's dead. So it's a very, very risky procedure. And so it's not something that is commonly practiced. A few has been done, and some people have been converted from SS to AA through that bone marrow stem cell and bone marrow transplantation. But the ultimate goal would be for us to get to gene therapy, where we can actually go into the gene, correct the gene, and then that will be permanently clear, because people then will begin to produce their own hemoglobin A instead of hemoglobin S. So we hope to get there very soon. So good evening. My baby of 8 months, I used to eat. Okay, I think I've answered this question. Did you ask it twice? All right. Please, ma'am, why does my baby stop for a few minutes and then sleep out? When I lay him down to sleep, is it for maybe 10 minutes and suck? So mothers need to realize one thing. Baby don't always suck only when they are hungry. That is, I think, it's a mistake mothers make all the time, because you expect them to suck because they are hungry. Babies suck because they just want to suck. And sometimes babies suck for comfort. They just want to be close to their mother. They suck for relief when they are upset, when they want some comfort, they suck. So usually, for example, if you want to do a procedure, like you want to take blood sample from a baby, or we want to give them an injection, that's how we give them analgesia. We just make them to suck on something, either cotton wool with glucose or something. So as they are sucking that process, we can do our procedure and they won't even know. So sucking is a form of comfort, is a form of analgesia, is a form of relief. So they are not only sucking when they are hungry. So the child wants to sleep and she just wants to use your breast as a dummy, as a something to suit, as a suitor to sleep. It's not because they are hungry. So babies can suck for that reason. And this is why some of mothers get confused and they think, oh, that means I'm not lactating enough. Oh, that means my baby is not getting enough breast milk because my baby wants to suck and suck and suck all the time. No, it doesn't mean your baby is not getting enough breast milk, because every sucking is not about food for the baby. Babies suck for several reasons. Okay, so they suck, of course, to get food, but they also suck for comfort. They also suck to be close to their mother. They also suck because they just want to feel your warmth around them. They also suck just to want some security. So they suck because they want something that will kind of suit them to sleep. So all those short sucking, those ones are not for food. Those ones are just for comfort. and release. So you need to understand that. So what you need to do is that you don't have to breast. If your baby is already fed and it's full, everything, so you don't have to keep on breastfeeding them at that point. You can find other way to comfort them. So your baby wants to sleep. For example, we have advised that you don't just go to put the baby to sleep immediately after you feed them. If you keep them upright and all that, let them bring up a little bit, bring out all the hair and all that before you put them to sleep. Your baby is trying to sleep, you can rock them, you can pat the back. You don't always have to put them to breast as a solution for everything. so that's just that. So there's nothing going on. Sucking is not just only about food. Or if you understand that, then you will not worry about that. Good evening, I'm not lactating well. So you have to go to our guide section. There's a guide one on breastfeeding. By the way, August is breastfeeding week. We'll come again and talk breastfeeding. So you can watch all the breastfeeding videos to know why you're not lactating. But let me just start by saying lactation is from the brain. It's not from your breast. Okay? Mothers need to understand that you lactate from your brain. So when you are stressed, when you're worried, when you are anxious, when you are going through all sorts of things and you are not relaxed, you are not going to lactate, no matter how much food or drink you took. So you have to always so when I counsel mothers about breastfeeding and lactation, I always tell them relax. Some people just think I'm just trying to make you feel good, but it is actually the solution to your breastfeeding. You need to relax. Your brain needs to rest because the brain needs to produce the hormones. Breastfeeding is hormone dependent. There are hormones that stimulates breastfeeding, that stimulate lactation. When you are stressed, you produce what we call stress hormones. Now, this stress hormone, cortisol and the rest, they are anti-breastfeeding hormones. In other words, they kind of suppress lactation so that your body can deal with other stress, okay? But when your body is at rest and there's no stress hormone, then all your oxytocin and prolactin, those hormones that promotes lactation, they are going to be released. So we always tell you, think of your baby, relax, you got this, you can breastfeed your baby and you can do it. So relax. I don't want mothers working and struggling with housework. All those Omugo people, that's what they should be doing. The only thing you should be doing as a mom is just to sit, eat, sleep, and breastfeed. That's all. Okay, so you need to relax. You need to stop stressing over whatever is stressing you. Eat well, drink a lot of water, and then your milk will flow. And let your baby suck. And breastfeeding is also demand and supply. The more your baby suck on the breast, the more the milk will flow. That is it. So those are the things that you can do, and it will help. But if you also need help, we have lactation consultants. We have all these our experienced matrons. We have pediatricians, because breastfeeding is both science and non-arts. Sometimes we need to teach you how to breastfeed. Sometimes we need to help you breastfeed. That's why we have lactation consultants. It doesn't come natural to some people, so you need help. And unfortunately, sometimes in some of our private hospitals, some of our nurses, everybody is just in a hurry. Nobody wants to help a new mom establish lactation. They just go get formula. No, they are not helping you. Okay, so what they need to do is to help you, teach you how to sit, how to rest your back, how to lift your leg, how to position your baby, how to make sure the baby is well attached to breast, lashing properly. These are all the things we need. And then we watch you breastfeed. Sometimes we do it in our clinic as pediatricians. So we watch you breastfeed. We teach you, we correct all those errors, and just relax. Breastfeeding is supposed to be natural, relaxed. It's not something that's supposed to stress you at all. And as your baby suck and you're happy, your baby is happy, the milk will flow. It is as natural, it's the most natural thing in the world. All right. But sometimes you just need that help. All right. Okay, so I think I will just go to Instagram quickly because Instagram people questions are not many. Somebody is asking Mrs. Taramala, what is the cause of speech delay for a 2-year-old? Sometimes there is no cause. Okay, some children are just a little bit slow with their speech, and then they will catch up. But sometimes it could be part of other developmental issues. For example, it could be part of autism. It could be part of global developmental delay. It could be part of cerebral palsy, other developmental issues. So if your child has speech delay, you can see a speech therapist for initial assessment. They will figure out whether it's just speech delay or whether it's part of wider developmental issues. And then in that case, you have to see a developmental pediatrician for further assessment. And if you need tips on how you can promote your child's language, there are lots of videos on YouTube. If you go to our Facebook group, Ask the Pediatricians Facebook group, we have our guide session. Guide 4 teaches you all the DIY. How do you promote your child's language? It is not by making them babysit them with TV or cartoons and all that. No, those things don't promote language. It is by you interacting with your child, playing with them, giving them choices, helping them to understand, and slowing down your own language. Some of you speak to children who don't have any words in long, complex sentences. How are they going to understand that? They are not going to. So you use one word, apple, banana, let the child make a choice. You give them one word at a time and you slow down your own language to the level they can understand. So there are lots of tips like that. Speech therapists on YouTube, lots of videos you can watch. You can be your own child's therapist, or you can also watch, go to our guide session and pick up some of those tips as well. All right, our time is almost up. I'll just try and finish this. Okay, any idea how much a CVS test costs? You should if you are worried that you may need prenatal diagnosis, it's better you go to the sickle cell center or you go to the gynecologist and have this conversation with them. So it's not just a procedure you can just do. So the people that's going to do it, they need to talk you through, they need to counsel you about it. There's always a risk of miscarriage for every pregnancy during that procedure. So you have to know that as well. And so, but they will talk you through it. And I don't know whether you're in Nigeria, in another country, different countries, but you just have the conversation with people that's going to do the procedure itself for you. All right, thank you. I will just rush through the rest. My baby's birth weight was 2.3, 10 days after by 2.25. Yeah, baby lose weight. In the first 10 days, they're going to lose weight. There's something wrong with that. So we expect that. But they should gain it back by 2 weeks, and then they'll begin to gain weight. So you don't have to worry about it. Good evening, Alayenka, Alayemi. Is it okay to add potash to cook away do given to baby? That's a little bit tricky. Of course, babies need potassium here, but you just have to make sure it's not too much. Just a little will be fine. But make sure you don't overdo it, because then that's going to cause too much of potassium in the blood. But a little will be fine. What does zinc sulfate treat in babies? Zinc sulfate will give it for diarrhea. So zinc sulfate is not treating anything. Zinc itself is one of those micronutrients that children need, and zinc is very important for what we call the linings, the lining of, so most of our organs, they have what we call linings that covers them, the epithelial linings, it covers the eyes, it covers the intestine and all that. So whenever a child is having diarrhea, for example, those lining is shed away, all right, into the stool, and that's why they cannot absorb water from the digestive processes ongoing, and that is why they are passing it out as diarrhea. Okay, and that's why they have all these watery stool. So what zinc does, it helps to repair the lining of the respiratory system, the lining of the gastrointestinal system, so that the lining is like what's act as a barrier between all these microorganisms, all these germs, and the rest of the body system. So it's very good that it's well maintained. So when your child has diarrhea and we give zinc, it's not a diarrhea stopping drugs. It's meant to repair, to help with the quick repair of the intestinal lining. So that will help with diarrhea currently to stop, but it also prevents future episodes of diarrhea and future episodes of pneumonia as well. And zinc is also very important for brain development. It's also one of the micronutrients that the brain needs. So it's something that we should all be eating as part of our diet, but some people may not have enough of it. So when children have diarrhea and all that, we just give them the zinc as a way to make sure we quicken the process of healing of the intestinal lining and other things that the zinc does in the body. I hope I'm not giving you too much medical jargons, but just know that it's a good thing for you to give your baby, and you should do it for 10 to 14 days. All right, good evening, ma. Other mothers talk about their breastfeeding about breast being hard with milk. Okay, yeah, breast being hard with milk is what we call congestion, but it's because they are not attaching the baby well to the breast. So baby should not be sucking on the nipple. A lot of mothers, again, this is part of why we need to support mothers with breastfeeding and why we do breastfeeding week. Attachment of the baby to the breast is 98% of the breastfeeding. If you don't get the attachment right, you're not going to get the breastfeeding right, and you're not going to get frustrated, and that is the problem. So when babies want to breastfeed, we need to put not just the nipple, which is what most people, and most babies, when they want to grab, when they're in a hurry, they just grab on the nipple. The nipple is not, and that's why they will bite on your nipple, get frustrated because no milk will come out to them, and then they'll keep on biting on the nipple, and the mother will also have pain, and that's why some of you have sore nipples, because this poor attachment of the baby to the breast. So beyond that nipple, the nipple is the one that projects out. You see that black surface, that black part of your breast, what we call the areola. That is where the breast milk sinuses, or the bank where the milk are stored. That is where they are. That is where that is if you press that place, you see the milk gushing out like tap. So that is where the baby's gum mouth should be, not on the nipple that is just pointing out. So you need to make sure that your babies, when they want to breastfeed, their mouth is open wide, and you push almost all of the breast in their mouths. Make sure the whole of that black areola part is in the mouth of the baby. You should barely see it, so that when the baby puts their mouth on the areola, the milk is just going to gush into the mouth, and then they'll just keep sucking and they'll be fine. But if you just put only the nipple in their mouth, they will just be biting your nipple. You are going to have nipple sores, and then the milk is not flowing out. The milk will just be full in your breast, and that's why you have pain in your breast and congestion. And some people, if you don't manage it well, it will end up leading to what we call mastitis, like wound infections and all that. Then the mother will have to now go take antibiotics, and you can't even breastfeed when there's a sore or wound in your breast already. And that's what some mothers encourage. So you need to make sure your baby is well attached to the breast. So that's number one. So for your own case, because you say you don't feel your breast, it doesn't leak and wet my dry, but when I breastfeed milk, so if milk is coming out, then you're lactating. You don't need to feel your breast. Of course, in between your breastfeeding, it doesn't have to be hard, but you should be full. There's a difference between being full and hard. Hard is painful, and you see some mother will start having fever and all that with their own hard. That is engorged breast, and that is due to poor lactation. But if you breastfeed your baby now, in another 3 hours, your breast should feel full. It doesn't have to leak. It doesn't have to be painful. It doesn't have to be heavy, but you should feel like this breast is fuller. When your baby suck, you will feel your breast empty. So you will know. These things are things you will know as a mother. So I don't know how to explain it, but you will know that, oh, my breast feel full, or my breast, So if you are not feeling full enough and all that, it's either you are not breastfeeding well enough, or you are doing mixed feeding. Because if you are doing mixed feeding, most of your baby is taking most of the formula, and they're not sucking on the breast. And when they're not sucking on the breast, nothing is going to be produced. Breast milk economy is demand and supply. It is as simple as that. If there's no demand, there will be no supply. So if you give your baby formula, and then you now want to give them breast milk, as long as they are not sucking the breast all the time, the milk will not be produced all the time. So the brain is calculating how much requests are we getting, and that is going to determine how much supply we're going to give. So you need to make sure your baby is sucking on the breast all the time. That's the only way the milk will also keep flowing all the time. But if you are doing misfeeding, that may be the reason. That is how some of you win your baby unexpectedly. Oh, my breast is not coming out again. My baby is not even sucking again. You have won the baby because you are not breastfeeding all the time. So, which is why we don't encourage bottle feeding. We don't encourage misfeeding. We just want you to breastfeed exclusively and on demand all the time. And that's it. I hope that helped. But if you go through our breastfeeding videos, all this information, they are there. Why does my baby shake when breastfeeding? Shake where? Shake what? You need to tell us what baby. Baby should not be shaking at all. So I really need to understand what you mean by shaking. So your baby should not be shaking. So baby can move their hand, they can touch their legs, sometimes they touch their head, sometimes they touch their tummy. There's nothing wrong with that. When they're enjoying their breast milk, they can show signs of pleasure. but no baby should be shaking. So the way you put it is where I'm answering your question. So you may need to explain further what you mean by shaking. What is baby shaking? What is shaking? So we really need to understand that to be able to address that question. Good day, Amarachi. Good evening, dog. Is it true that carrying a newborn baby will make the baby get used to being carried? You don't have to carry your baby all the time. Of course, if you carry your baby all the time, baby will like you to carry him or her all the time. And then you're the one that will also come and complain that your baby doesn't want to be lie down. Your baby wants everybody to always carry the baby. So one of these principles you should always do is that allow babies to fall asleep on their own, on the bed. You don't have to wait on baby is sleeping in your hand before you put them to the bed. Once you feel them, maybe 15, 30 minutes, you keep them upright so that they can burp and all that. Just go put them on the bed. Even if they are not yet sleeping, if they are a little bit fussy, you can rock the bed a little bit. Most of this your bed, they can move a bit, or you can just pat the baby on the bed. You are there by the side and all that. But you don't always have to like make them sleep on your chest, on your back, or your hand before you put them there. Let them get used to their home bed, falling asleep on their home bed. Let them learn to lie on their bed when they are awake and sleep or play on that bed. So that way it will not become an habit. Yes, babies can form, just like any other person, you form good or bad habits depending on what you're used to. So I hope that is helpful for you. All right, I think I've answered that. Does drawing a baby's blood for tests affect the baby? No. Taking blood from babies doesn't affect babies. We do blood tests. Well, of course, we only do blood tests when they are necessary. Fabulu Day, good evening. My twins, 6 months, 28. They are preterm, 35 weeks, blah, blah, blah. Okay. When the right time to start complementary feeding, just start when they are 6 months old. Your babies are more or less near-term babies, 35. For them, I would just say start at 6 months. 6-month chronological age is fine for them. No worries. Thank you very much, Alayinka. You're welcome. Good evening. Can I take a Artemether malaria drug? Why? You didn't tell us about yourself. Just say, can I take it? Will it affect my baby? You didn't tell us who you are. Are you pregnant? Are you breastfeeding? Which one? So that we will know how to address that question. Right now, it's just standing alone. So anyway, what we normally recommend, we don't recommend self-medication. We want you to see a doctor if you're sick, especially if you are pregnant, especially if you're a breastfeeding mother. Please do not self-medicate. Always see a doctor if you're sick, okay? Some of you just treat unnecessary malaria, you treat yourself for typhoid. All those things are not good. Please, if you're sick, you go to the hospital. Let the doctor do your tests, confirm what is causing the symptoms, and then prescribe medications for you. There are medications you cannot take as a pregnant mother. There's medications you cannot take as a lactating or nursing mom. So please don't self-medicate. It's so important. All right. I think our time is up. So I'm just going to thank all of you for watching and for listening. But if you still have any questions, feel free to post your questions on our Facebook group. We have 4 Facebook groups. All right, we have 4 of them. So we have, of course, our main group is Ask the Pediatrician, so which is our group or platform for asking children health issues. Some of you post your question anywhere you like. Please try and keep to our rules. There's a reason why we try to maintain all these boundaries and all that. So if you post your children's health issues on ATP Family, we're not going to answer it there. Even though it's the same Dr. Baby that is there, or won't answer it there. You have to post it on the Ask the Pediatricians for Children. But if it's for your own self, you can post on ACP Family. First time mom, we have the FTM baby group, and those who have experienced losses of pregnancy or child, you can post on ATP Still a Mom if you want like emotional, psychological support from fellow mothers who have also gone through the same challenge. So you can post this on our ATP Still a Mom Facebook group. But please try and keep your questions in the right groups. So you can post your questions from Mondays to Saturdays, 24 hours daily, and we'll answer them. Of course, we don't answer questions immediately. Okay, so we don't run an emergency. We are not always online 24/7. All our doctors, all our all the people that answer questions are full-time professionals who have other work. So they do ATP work as a voluntary thing. So we always say that if you have something that's an emergency, please and please go to the hospital. Don't post it on our Facebook group. Your child is convulsing, your child is not breathing, your child has stopped breathing, your child has a major accident. I believe parents are very sensible. So just do what is sensible. Go to the hospital. But if you want to know, oh, how do I breastfeed? How do I do complementary feeding? How do you do things that will help your children? These are not emergency. Your child is well, but you want to know how to keep them healthy and how to support them. Yes, we are happy to answer those kind of questions. But anything that you have to do now, or the child is going to die, please and please and please don't put it on ATP. Please go to the hospital. We have our what we call it, disclaimer policy in place. Please read it and understand that. Good evening, my one and only baby. I've been having rashes from February. Blah blah blah. Da 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 da. Okay, you have seen pediatricians. You have seen many doctors. I won't be able to comment on something you've seen other professionals for. So I'll recommend you go back to them if your child is not better. Or you can go to see specialists in, like, if for example, if it's a skin condition, you can see dermatologists and all that. So I'm happy you've already seen professionals. So just go back to them for follow-up, all right? Or you can see other specialists. Naomi, maybe it's really, please don't give teething powder. I'm going to I'm going to scream now. No teething powder, please. It's the most dangerous product ever. Your children bringing out teeth is a completely normal development. It's a completely normal thing for children to bring out their teeth. They don't need no teething powder. Just like they don't need walking powder and they don't need teething powder, they don't need no teething powder. All right. It is normal for children to bring out their teeth, and teething does not make children to fall sick. All right. And drooling, there's nothing wrong with children drooling. It's okay for them to bring out saliva. Clean it, wipe it with the babe. That's all. You don't have to give them any medication. Please, you can go and read about my Pekin story. Then you understand why you should never use teething powder or so-called teething mixture ever again. Please just stop it. Go throw it away now. Don't give it again. All right. Okay. So if you want to know more about this, go to our website, www.askthepediatricians.com. Or you can always post that question on Ask the Pediatrician Facebook group. On Thursdays, I do teachings on important topics. Initially I was thinking I would do sickle cell anemia, but I actually have done one for a mom that was asking about sickle cell anemia. There's actually a podcast already on sickle cell anemia. I recommend that you watch it, but I'll be bringing a particular topic. And of course, you can listen on our Facebook page, YouTube channel, or my podcast, Ask Dr. Gbemi ATP Podcast. Just search for it's Ask Dr. Gbemi ATP Podcast. It's on stream. It's on Spotify, on Google Music, Google Podcasts, Apple, Amazon Music, and most of the podcast platform. You can listen to it and you can learn. And of course, if you want to read, you can read on our website. And if you have questions, you can post on our Facebook group. So thank you so much, everyone, for watching, for listening. And I will see you again same time next week, Monday. God willing. Have a wonderful, wonderful weekend. Bye from me. Bye.